we know are tricky to diagnose, doctors frequently can float the idea that a person's symptoms might be psychosomatic, essentially all in their head or caused by anxiety. Dr. Mina Merholm joining us now. That's a tough pill to swallow for a lot of people. Yeah. Autoimmune diseases are especially hard to treat, and to be told this anxiety, definitely not what you want to hear.
It's very tough, Marina, especially because the vast majority of folks impacted by autoimmune diseases are women. 4 out of 5 folks who are struggling with autoimmune disease are women. And it's on the heels of Women's Health and Women's History Month. This is an important area for us to shine light on. Shout out to all the women out there who are struggling with this. Shout out to my mom, whose birthday is this today. So for us to be able to think, why is there anxiety tied to these diseases? One major thing is that there's a fluctuating up and down pattern with autoimmune disease as well as with anxiety. So there's a lot that we can do for a patient standpoint of how do you advocate for yourself when you're going to see the doctor with those symptoms.
Let me ask you, is this bias? Do you think this is some medical bias against women and women's claims of when they actually are having pain? You know, we keep hearing the reports that they don't listen to women, they don't listen to African American women, and women, so is this what we're seeing? Is this the result of that?
There's a part of that, Joe, and that's why there's a big emphasis in the medical training process on how to elicit a history and how to best, there's an old adage in medicine that if you listen to the patient well, they'll tell you what's wrong with them. And from the women's standpoint, the big part that we want to emphasize is if you are experiencing that bias or if you're being dismissed or sort of a medical gaslit in a way, here's how you can advocate for yourself by having as much objective symptoms as possible. Keep track of how often this happened, what the pattern was, when it first began. That also helps give objective data to the person you're speaking to, so it's not just dismissed as another anxiety symptom which can come and go.
Yeah, no, I think those are good tips. Tracking things and showing something to the doctor, being like, hey, listen, this is what's happening. I don't know what it is. Maybe you have experienced anxiety and it doesn't comport like the previous episodes of anxiety, and therefore it's got to be something different. But I think to Joe's point, there's got to be a lot more understanding of all of us, especially when we don't share the same anatomical parts and same chemical balance. That can be very difficult to diagnose.
And ladies, take your notes to the doctors with you, because he don't know what he's talking about.
Not you, Dr. Merle.
Not you, doctor. I'm sorry.
I know.
I didn't mean you.
I know you believe in me, Joe. You believe in me. I got you,
man.
But one thing I just wanted to mention before we go is part of the reason this is happening is more so genetic. And that's something we're discovering. The research at Stanford is really showing us some light as to why this is happening. So I just want to encourage folks to be an advocate for themselves.
Thank you so much, Dr. Merle, for listening to us.
Yes, he's the one that's telling you the other doctors don't listen. No, he's the good doctor.
Thank you, Dr. Mina.
Thank you.